please feel free. There's also any previously recorded webinars there as well. And with that, I will get this started, and the recording is launched, so I'll go ahead and turn it over to our presenters.
All right, thank you everybody for joining us for week 8. Hard to believe we've had 8 weeks of stuff to talk about, but as our pandemic issue keeps going, there's still more information to put out, and we hope that we're getting you as much of the most on-time information as we can. So as we always start out, I want to thank all of our partners that have joined us, our state agency partners, DEQ, BDH, who's supplied us with 3 speakers today, DPOR, and any other state agencies that may be on, all of our Virginia WARN members that are logging in to get the WARN update, as well as our non-WARN Virginia utility members that are logging in. Hopefully this has been useful information for everybody, and if you're liking what you hear, I hope this will drive you to want to become WARN members. And any additional VA partners that we may have on, whether you're a supplier, maybe you do maintenance or mechanic, or you do upgrades or construction work for the utilities, we appreciate having you on board. Okay. So our current situation update. As you know, the governor has started phase 1 preparations. We're starting to move into phase 1. Some cities and counties chose to stay out of phase 1 for a week longer than normal, but they're starting to they are starting to move also with the rest of us into phase 1 at this point. Our agency updates, we're going to have VDH speaking, Virginia Department of Health, their Office of Drinking Water. We have Tony Singe online with us today. He's the Deputy Office Director for the Office of Drinking Water Program. We have Bob Edelman, who is the Technical Services Director with the Office of Drinking Water. And we have Dan Horn, who is the Engineering Field Director for the Southeast Virginia Field Office. So they're going to give us some updates, especially as we start talking about reopening and opening Virginia. So they've got some good information to share with us today. Okay.
Thank you, Ike.
I believe, Tony, this is you. Yes, sir.
Thank you, Ike, for the nice introduction. And thank you all VA WARN members for having ODW team on this exciting webinar. We are really pleased to be part of this. And this slide, we all know that safe drinking water is essential at all times, but it especially becomes critical during difficult times such as this pandemic, COVID-19. And you all, public water systems, they have a heightened responsibility to protect public health, as unsafe drinking water can lead to serious illnesses. And citizens need drinking water at all times for life and other critical needs. And you all, waterworks owners and operators and the staff at our utilities, must continue the excellent work that many times you consider normal operation and maintenance to the extent possible to ensure required supply of drinking water to all Virginians. So we truly think that you are our heroes, and thank you for all that you're doing on a routine basis. Thank you so much. And next slide, please. So back in March of 2020, we were hit with the COVID-19. Of course, I mean, COVID-19 hit us before that, but we saw some statewide actions in March, and that prompted us to look at the safety of our staff, our stakeholders, waterworks staff, and overall communities. And the big question was, how can we participate in reducing that spread of COVID-19? So one of the measures that ODW undertook was to suspend our field operations, and that was implemented on April 1st. And during that suspended period also, ODW implemented a remote surveillance program for these inspections. The thing that we were doing is that instead of visiting utilities on site, we were trying to do that over the phone or over video conferences. And our field offices, they worked really nicely with our utility partners, and thank you so much for that. We did share that remote surveillance program with other states and EPA, and we got really great feedback. And as Ike mentioned, we have some recent development at the state level to reopen some of our businesses, some of our offices. And in line with those directives, ODW also resumed its field activities this past Friday, May the 15th, 2020. And one of the big question that we had in front of us when we picked up May 15th, 2020 was that are we completely safe, or are we completely out of the woods yet on this COVID-19? The answer was unknown at this time as well. But then we thought of opening our field operations on a prioritization basis with some cautions. And today our team is here to share with you some of the details on those plans. Next slide, please. So ODW field operation, especially field inspections or on-site inspections, we come up with some internal guidance for our staff on how can we prioritize these inspections. So on the slide you see that. And one of our criteria was that how can we safeguard our staff, how can we safeguard utility staff and public at large, and at the same time safely can reduce the risk to public health. So we decided with this approach of priority 1, 2, and 3. And the priority 1 inspections is for community waterworks, because they are the primary water source for significant percentage of Virginia's population, and they serve the largest number of consumers. So essentially in this priority 1, ODW staff will focus on completing the on-site portion of sanitary surveys at these community waterworks. They'll conduct on-site site visits, inspections, if there is any construction project, and then providing on-site technical assistance if required, and follow up on complaint investigations. And in the past 2 months or close to 2 months, we have used remote surveillance program, so that our staff will use that tele survey information or remote surveillance information to the extent possible. And ODW's second priority is completing these on-site inspections or sanitary surveys and providing technical assistance and other services at non-community waterworks that pose low to moderate risk of coronavirus exposure to ODW staff, as well as owner, operator, and facility staff members. And again, in that priority level, we have schools, factories, restaurants, and other facilities that don't serve population whose members have contracted COVID-19 or at high risk for exposure to the coronavirus. And community and non-community waterworks that pose high risk or very high risk exposure to coronavirus or severe at-risk communities, such as waterworks that serve an adult care facility for senior citizens, will be the next priority levels. And for waterworks that have an active COVID-19 outbreak, ODW staff will continue to communicate with owners and operators remotely via phone, webinar, or video conferencing. And as we all know, things are changing rapidly on this COVID-19 situation. So we may make some exceptions based on these priorities. For example, if there is a TNC system that may pose a greater amount, or that may pose a greater level of risk, so we may advance that system to the higher priority level. And that is our basic prioritization schedule that we will be following. Next slide, please. And this is a quick procedure for scheduling an on-site visit. So essentially, ODW staff, I mean, we wanted to share it with our utility partners on how this process will look like. And it'll not be that ODW staff will just show up at the facility sites. It'll be a detailed detailed way of approaching them. For example, ODW staff, they are provided with appropriate PPEs and guidance documents to safely conduct these inspections. And they are instructed to travel in their own vehicles, so there is no ride share. And they are recommended to keep social distance while conducting these site visits, and wear a face mask if for some reason they are unable to maintain that 6 feet social distancing. There are other measures and other guidelines that ODW staff has created for themselves, and those guidelines are currently posted on ODW website as well. So then ODW staff, they are expected to schedule on-site visit over the phone so that utilities have an understanding of when to expect them. And if utilities have any specific safety or other guidance for our staff, please let our staff know at that time. Our staff would love to work with you on following any additional safety procedures or processes while they are on site. And they're also encouraged to perform most of the legwork prior to the visit, so that the actual time on site could be utilized more effectively for the critical items, right? And if you have any thoughts or any concerns, just let us know at any time. I have provided Dwayne Roadcab, our office director's email and phone numbers, as well as mine. But at the same time, our field office staff, they work pretty closely with all of you, and they are excellent resources. So feel free to reach any of our field office staff, our field office directors as well. And is guidance final? That was another question that we discussed when developing these guidance documents. Probably not, as things are evolving pretty fast. So ODW will regularly review our field operations, and then we will make appropriate changes if needed, as per the feedback that we get. And to all the participants on this call, we are listening. So if you have any concerns or thoughts, please do share it with us. You can reach us again at central office or through any of our field office. And again, with this, the presentation is not over, but if you could move to the next slide. We have two other presenters that from ODW that will be talking more about this topic. Over to you, Bob.
Hi, and good afternoon. This is Bob Edelman with the Office of Drinking Water. I'm the Director of Technical Services. And the thing about building water systems is there's a new paradigm that building owners are probably not aware of, but should be becoming aware of, and that is building owners are responsible for the building water quality, the water quality inside their facilities. And so we believe it's important for buildings that are restarting operations to do some flushing as needed to restore the water quality. And why don't we go on to the next slide? And one more slide, please. So that involves, for the most part, we're talking about flushing the water plumbing systems in buildings. The consequence of buildings that are closed that have little or no use is that the water is sitting stagnant in the pipes, and that's not a good thing. It's not a good thing because the disinfectant residual that's normally in the water dissipates. The corrosion can occur, and disinfection byproducts can build up. And the consequence of all these things is that there's some risk, some health risk to the users of the building if they use that water that's been sitting around stagnant in those pipes. And so we want to encourage and educate building owners before they reopen their building for normal business that they should thoroughly flush their plumbing systems. And this would apply to all sorts of facilities, as you might imagine: schools, daycares, hotels, offices, churches, event venues, libraries, any number of facilities which have been closed with little or no use, which has been the case in many places. Next slide. So the good news is the Hampton Roads Planning District Commission has put together some guidance on building and flushing. And here's a snapshot of their website and the URL. And I think their guidance is pretty good. What's the best part about it is it's simple and easy to understand and easy to use. And I'll show you what I mean in a minute. Let's go on to the next slide. And so if you compare the recommendations from Hampton Roads to some other places like CDC and EPA, those are kind of clunky and have a lot of steps. And if I were a building owner, not a water system professional, I wouldn't be able to follow this, but I think you'll see why this is actually doable. And so the flushing is in 6 easy steps. First to remove and clean the filters, screens, and aerators on all the faucets, and then turn on the water starting at the lowest floor and working through the building and opening the cold water outlets. And we'll go on to the next slide. And also don't forget to flush the toilets and urinals 2 or 3 times. And also the kitchen sprayers and drinking fountains. I know the drinking fountains are kind of a bugger because you have to stand there and hold them to pull in fresh water. And don't forget about the ice makers, to empty the ice from the ice makers. Who knows how old that is? And then let that run and discard 2 additional batches of ice and let everything run for at least 30 minutes. It sounds pretty simple anyway. Let's go on. But there's more. Also, we recommend flushing the hot water, and that's important because the hot water may harbor some pathogens, including Legionella. And just like in the cold water, is also open the hot water outlets and let them run. The recommendation is 45 minutes, but that may need to be adjusted to account for the water heater volume, and do that all in the same order as in the cold water system. And the last recommendation is to check the setting on your water heater, and there's some discussion here. It's at least 120 degrees. Now, CDC recommends 140 to prevent growth of Legionella, but that presents some other problems because 140 might be too hot for your building occupants. But we'll just say that that's a complicated thing. So at least 120 degrees to prevent microorganisms from growing. Let's go on to the next slide. And we have some resources on ODW's webpage, and those are available for you and your customers to take a look at. One other thing I would mention is non-community waterworks, which are not service connections of community water systems, but waterworks of their own, may also be either shut down right now or thinking about starting up or had a season of very low use. Those water systems we would expect to employ their seasonal startup plan if they have one for restarting, and that would include things like flushing and possibly disinfection of their water system and possibly some sampling. And if a non-community water system doesn't have a seasonal startup plan, we would expect them to reach out and contact their field office for instructions on how to go about restarting their water system after an interval of 0 or low use. And I believe that's my last slide.
All right, thank you, Robert. This is good information, especially about the flushing procedures. We've had some comments going on. It looks like Scott got them put into the chat box. People are asking about this so they can look at these and compare them to their SOPs they have in place for building operations. Is ODW also going to be posting these on their site for people to go to and look at these flushing procedures you guys just talked about?
Okay. Well, these are already posted on Hampton Roads Planning District Commission's website.
And okay. To add to that, Ike, we do have resources on our website, and we recently developed similar guidance for our TNC systems. So all these documents will be posted on our website as well.
Perfect. I think that's what our people would like to hear, is how they can go and find these documents. Nobody wants to really create an SOP in a vacuum, excuse the pun, but if somebody else has a starter point that they can verify against, it seems to help out quite a bit. Tim is saying, in addition to building water system flushing, we encourage our customers to pour water down all drains to make sure P-traps are full and sewer gases can't enter buildings, which is a good point, Tim. Especially with the schools or these buildings that we haven't been in for a while, we want to make sure that our drains are re-wet. We don't leave that stuff sitting dry, especially if they're floor drains, like in janitor's closet, mechanical rooms, different places like that. Make sure we're adding water to those drains. So these are good points, good talking points. Dan, did we get all the points as you were thinking of them too?
Yes, indeed. We used a number of sources to create the HRPDC guidance, and that has been widely distributed throughout Hampton Roads. It's made a couple of the newspapers even. It's not copyrighted. It's meant to be used and shared, so everyone is free to use that. And there are a world of people who are putting out guidance. We tried to do something that was simple and easy to understand. We think we succeeded, and there are other folks who have guidance which is much more detailed and perhaps looks at some additional factors that we didn't think most buildings needed to be looking at.
Gotcha. Perfect.
And
all right.
This is Tony here. I'd like to add that recently CDC and EPA they have amended some temperatures in their guidance documents. So I would say that we may be updating our guidance pretty soon. But if our utility partners, they wanted to see those numbers, they can visit our website or directly EPA and CDC website. For example, EPA's guidance mentioned that maintain the hot water system, including keeping the temperature at or above 140°F as per CDC guidance. And in our document, we have mentioned 120 at one place. So there are some different numbers that our utility partners may need to look at it as well.
Okay. So we have one question for VDH. How many days of non-use in water considered stagnant and would need to be flushed? So how many days would somebody not be running water before you would consider that water stagnant?
We did not really pick a number, but if you know, I think in our TNC guidance we said if it was if the building was closed and not using water for a month to 6 weeks, then that's definitely ripe for having some sort of flushing operation occur.
Okay.
You know, if a building's been closed for a couple of weeks, then you might want to look to see if you've got a chlorine residual. Can you smell chlorine when you run the water? And if you can't smell chlorine on a chlorinated system, it's probably a good sign you might want to flush and get some fresh water in there.
Perfect. Okay. All right. So one of the things that for everybody to think about as we talk about these buildings that are reopening, some of these buildings are probably going to be some of your medical facilities like dental offices that haven't seen patients in a while. Make sure they have a good flushing program. A lot of the medical portions that are not emergency care that have been closed, you know, they need to be flushing all that. So even though the hospital may be open, they may not be moving the same volume of water that they had been moving before. So just look at all those things that normally you would have a lot more flow through that you're not having right now. All right.
Yes, we encourage people to do flushing, not just if there's been no water use, but if there's been extremely low water, you know, as you suggested, Ike, if you know somebody's got a large office building and there's been one person in there for the past 4 months, 2.5 months or whatever, it would probably be a good idea to get some fresh water flowing through there, because they're not using the water. It's going to get stagnant, and let's get it flushed.
And another VDH person is saying, when in doubt, flush it out. I like that, Jeff. Thank you. Okay, so as we're going through, and we talked about flushing ice makers, also look at any place where you may have soda machines or anything hooked up to your water systems that haven't been used. Make sure people are flushing those. From the utility standpoint, you can only handle up to the building and explain to the owners about the flushing program. You can't force them to do it, but this is definitely something to be looking at. Okay. Do you guys have any final comments on? Go ahead.
Yeah, we'd encourage utility owners and operators to reach out to their customers to make sure that the customers are thinking about the flushing. Obviously the water utility cannot require flushing. They don't own the building, but it would be good customer service to reach out and suggest that people do some flushing.
Cyrus put on here, he looks like he went out to cdc.gov, and he says that CDC says water that sat more than 24 hours should start being considered for stagnation of lower levels of chlorine past disinfection capabilities. So thank you, Cyrus. So this is good information. So hopefully what we're doing, not that we're trying to beat a dead horse here with all the utilities, but you're starting to think this and you're starting to write this into your SOPs, all those different things. How are you going to get that information out to building owners? Are you going to give them a checklist of things to go down, or are you just going to suggest it? Everybody's going to approach this at a different methodology, but if we can get some commonality across the two industries here, I think it's going to help to go a long way. So, all right. So our next slide, and by all means, if you guys have any more questions for VDH, please post them and we'll get them to VDH. They're going to be on with us for a while. Or chat questions, go ahead and put them straight in. But our next slide is our VDH COVID-19 map. This is our total number of cases being shown here in Virginia as of this morning. Currently, we have 3,979 hospitalized. Total cases is 32,908, and that's the cumulative cases. That's not how many are active right now. That's how many we've had since the beginning of this. Total deaths, we're sitting at 1,074. So our bar graph here, or our bell curve graph that we're looking at, is showing that we're starting to move to a downward trend on cases. We are expecting, as things reopen and people start associating again and start doing more things together, that we're going to start seeing probably a quick upsurge in new cases, and then it'll probably start trending, flatten out, and then trend back down. And that's just as people start coming together and they find out, some people may have come out of quarantine a little too early, or maybe they didn't know they had it and they start exposing to other people, and we'll have those reactions. And this is kind of going to lead in a little bit too about mask policies as we move forward and doing things that we need to around that. And I have a question for VDH real quick. Does anyone know why Virginia is not? Oh, I'll follow that one up. All right, so warrant updates. So far, we still have no emergency requests to date. We've had 3 new warrant members recently sign up. We have the town of Alta Vista, Massanutten Public Service, Whitetail Resorts, and so far our supply list information is still supported on our warm webpage. Next slide. Scott, did you want to speak to the phase 1 a little bit?
Sure, Ike, thank you. We thought it would be worthwhile, and I think we've all seen the experience this week. I would qualify the phase 1 as a rolling movement into phase 1. Conditions have been slightly relaxed. As we've often seen noted in the news, it's not a light switch. Everything's not turned back on universally, so that's something that's worthwhile noting in your planning. Businesses are going to open at their own pace, and so we're likely to see this spread out. At the same time, it's providing some opportunity for us to utilize information coming out in phase 1 just to make sure that as utilities, we're staying ahead of the curve. As was referenced earlier, some areas in the state have been granted a waiver from entering the first phase. What we've got up on the screen now are the new key elements of phase 1 in Virginia, the Safer at Home modification. You'll see that most recommendations look very similar to what we've already dealt with in the essential business phase. So if we can go to the next slide. One of the things that is occurring with this, though, are we're seeing additional guidelines issued for different types of business. So we've seen guidelines issued for religious services. We've seen guidelines issued and updated for retail establishments, obviously for beauty services. And so those new guidelines are excellent surveillance items for us as utilities to take a look at so that we can go back and gauge our current procedures against evolving best practices. And there have been some changes within the guidelines, and we're going to highlight a handful of those to make sure that they don't sneak past us, that you're able to go out and take a look at those and determine if you need to update any of your existing policies. So if we can Next slide, please. One of the best practices, and we've talked about this previously, this is surveillance of employees on a daily basis that's recommended by VDH. This guidance has been updated, and so what you're seeing now are the 6 questions that VDH suggests need to be asked each day of employees. This is likely going to take some different forms. Small utilities may actually task a supervisor with actually asking these questions. In our case, a large utility, we're going about it a little different. These will be posted on time clocks. One of the things that retail establishments are being encouraged to do is to put a posting on the doors to basically, in some fashion, mirror this, to ask individuals who may have been sick or exhibiting symptoms in the last couple of days to please not enter the space. I think that we likely have seen similar activities across a lot of utilities. A lot of spaces are closed to public, but where we're interacting with vendors, you may have posted notices. I think it's worthwhile looking at this updated VDH questionnaire and making a determination whether this is what you'd like to use and should you post this on your public-facing entrances, particularly when you move into actually public entry phases. How are you going to handle that aspect of questioning individuals on their current health? And so I think that our best practice is likely to mirror and stay very similar to what's being done in the retail establishments. So next slide, please. This is a second element to the VDH best practice on daily screening questionnaire. These are just the recommendations of if you encounter illness in an employee that comes directly from VDH, the requirement to immediately isolate the ill person from others. We had some good discussion on this. That does not mean isolate at work necessarily. You may isolate temporarily till that individual can go home if their sickness level is not such that it requires medical care. Then, of course, if we have any kind of medical emergencies, just the notation to call 911. So this in totality, the last 2 slides are the new and updated VDH guidance for employee surveillance questions. So you may want to go back, take a look at your existing practices, and make a determination if you need to update those. Next slide, please. All right. The other thing we wanted to highlight are the updated mask requirements, because now that we're seeing other industries issued guidance, I think it's worthwhile for us as utilities, again, to use this as surveillance so we compare to our current procedures. So what we've got is a guidance specifically issued for religious services, making a recommendation of wearing face coverings. There's a definite requirement in guidance for salons and barbers. It's probably one of the more stringent requirements. You'll note in there that they are to provide face coverings for clients or ask clients to bring a face covering with them that they must wear during the service. That's something that I think is worthwhile thinking through as we prepare at varying stages at utilities to reopen lobbies, to take activities where we invite the public back in. It depends on when you're implementing that. I think that's, and frankly, we're probably all seeing that. You're seeing some retail grocers who actually are advertising now, asking for customer space unless they're using face coverings. This gets into really what's going to be accepted as the best practice. As we've discussed in previous calls, VOSH is going to have the ability to come in and evaluate workplaces should they receive a complaint. And so it always goes back to the question is, what is your best practice? And so there's some variance on the guidance, and obviously even within these guidelines that we've got published, But I think it's incumbent on utilities to really make that decision and go through a thought process of why you're adopting the procedures that you're going to utilize through the course of this pandemic. Of course, the retail guidance is up. That's also a recommendation. And then there is a Virginia all business guideline, and that's really the catch-all. So again, we'd encourage you to take a look at the updated guidance across all sectors and compare that to your current stance on masks. Next slide, please. On the mask requirements, I guess it was a couple of webinars ago, we did a poll question and we asked utilities on the call, what's your current policy on masks? And there was probably a predominance of utilities that had adopted a voluntary mask utilization policy. Since that time, we continue to accumulate some additional data. I think it's a couple things that we want to highlight is recently in the proceedings of National Academy of Science, it did make national news and got some coverage where there was a fairly unique utilization of lasers to evaluate airborne transmission risks of the SARS COVID-19. In that particular study, they found that just normal talking, just the normal activities, not necessarily coughing, sneezing, did impart airborne particles of the virus that could stay airborne for up to 8 minutes. We've seen other studies, both foreign and domestic, that have given similar indications. Now that we're beginning to see increasing data from countries all across the world, there's beginning to be a fair amount of evidence stacking up that the countries that have adopted required face mask policies are probably seeing a quicker reduction in cases than countries that have taken a voluntary stance. I think all those things are items that are worthwhile for us to consider as we're adopting our policies. I would point out, and we've thought about this in our utility, the cost, both from a personnel standpoint and impacts on personnel and families, as well as just the true incurred cost of a single case of COVID-19 to a business or a utility that's paying the health insurance. Ultimately, the health insurance is always going to translate and go up based on exposure and risk. And so any utility that begins to see substantial treatment costs, that's likely going to have a long-term impact across all of your employees. So to us, and I'm speaking from my utilities perspective, the use of face masks is just a slam dunk. We're not going to make that a voluntary. I would share with you all that in our next phase, and I think Mike can speak a little bit more to this, Albemarle has shared one of their recent face mask updates for their employees entering the next phase. I think it's very prudent to make that requirement with any utility. And the other side of that, of course, is the availability of masks now. That was a prior problem. And since we have received the FEMA /EPA face masks, those are available to utilities. We still have a supply on hand, and we'll talk a little bit later about what you can do to still make those requests if your utility needs to obtain masks. Next slide, please. All right, the other item I just want to highlight is in the first phase of the pandemic response, many utilities, us included, adopted a no travel policy for their employees. Oftentimes we heard or encountered utilities who had requirements that there was no travel by their staff permitted beyond a 50-mile radius or whatever the limitation that was imposed. some did, and we understand that some did not. One of the things that we've encountered in this next phase of discussions is we see reopenings. Things are different in different states, but we're entering vacation season for our employees. And so internally, as we prepared our next phase of operating plans, we were interested in developing a policy that, one, would empower the employees to do surveillance on their own for potential vacation sites as they're looking around and deciding where their family may travel. The second piece to that is we wanted to encourage them to make good choices, is by empowering them with the data. We've adopted requirements, and basically the requirements in our policy that we are going to share on the Warren resource page provides a range. And so we're basically saying if you travel to a county in a state that has a substantially higher COVID transmission rate, and we're looking at the per 100,000 case count and using the CDC website as a resource. It's got every county in the United States, and you can see their case counts. So it's apples to apples. But what we've looked at is we've developed a baseline rate for our utility, for our service area, but we had a limitation of 50-mile travel. So within that 50 miles, we also identified what community would pose the highest risk from our employees' normal activity of shopping and just general activity in that community. And so we utilize those baseline rates to then establish what we would consider a high-risk category of travel. If you travel to a high-risk county and you choose to do that, and again, it's on a voluntary basis, a voluntary vacation, we're warning the staff that could end up causing us to put them into a requirement for a 2-week self-quarantine upon return to work, and in those cases, they would have to utilize their own vacation time. Now, in our policy, we are treating that like a light duty requirement. It's a case by case. It'll be reviewed by management and human resources to determine if there's a path for that employee to complete work from home to satisfy that requirement, or whether it would translate and require vacation utilization. I can share we've done a little advanced work. We're in process of, we try to roll these things out where it gives management members, some employees, an opportunity to see the policy in advance so we can gauge if there's any modifications we need to make. So far, it's been very well received. We've had a lot of comments from staff that they're appreciative of the resources that let them take a look at their potential vacation plans and then try to plan out safe points where they feel comfortable taking a family vacation. I can tell you the Roanoke region's case rate has been relatively low. So that same approach can be challenging if you're in a high transmission community, how you may modify that. But I think that it is a good point in this next phase of operations to just consider how you're going to modify any travel restrictions that you currently have, or as things open up and you're going to see increased employee travel, do you need to take any actions to protect against staff bringing back unintentionally infections from their vacation, from their travels into the workplace? So, Mike, I don't know if you want to talk a little bit about the Albemarle mask policy, what you're all doing next phase, and the resource that's up on the website.
We currently, I sent it to Geneva a few minutes ago. I posted our mask policy for staff. We've determined that if you're out in the hallway going to a public area such as a restroom, break room, if you're in the building, you will wear your mask. If you're around other people, you will wear your masks. We're also encouraging frequently washing of hands, hand sanitizer, cleaning of your desk surfaces. We're making sure that we give all of our employees plenty of hand sanitizer when they're out in the field. They've also been told if they are approaching a customer to have a conversation or to give some information to them, they're supposed to be wearing their mask. So we've already implemented the mask practice policy that we're going to enforce through the rest of the phases.
Awesome. Good information. One thing I do want to point out, so we talked a little bit about the making sure we smell our chlorine. We talked about this earlier. Make sure we smell our chlorine as we're flushing. But one of our attendees, what they pointed out is make sure we don't huff that, because the last thing we want to do is take in Legionella. So make sure when we're doing it, we're being smart about how we go about handling that. Geneva is going to talk about your certificates on how you're going to get those. And yes, we'll try to provide the link for the daily health checklist from BDH. But one thing I would like to talk to people about real quick before we move on is, as we move into this flushing process, make sure we're looking at what we have for chemicals, because some of us it's going to be 1 or 2 buildings, some of us it's going to be shopping malls and a big amount of flushing. So make sure we have what we need on hand and that we have our backups that we can get to. So Geneva, I'm going to turn this over to you for continuing education credits.
Great. I am going to launch the one and only poll that we have for today. Those of you that have been with us in the past know that we traditionally do polls. This week we didn't have any, but this one that you're getting right now is incredibly important. This is how you would receive your water or wastewater or engineering credits. So to clarify, we had spoken that these transcripts would be coming to you by email. That email was just sent out yesterday. And I have on the screen the email address that it's going to come from. It will not come from myself or Scott, but it will come from this email address at admin@mail.eventful-us.com. So if you did not have a transcript, you've watched a previously viewed webinar, a previous live one, but you have not yet received that email, please check your spam folder or maybe your junk. See if there's a way to enable this email address to come through, and hopefully it's sitting there waiting for you. It will let you know that you have attended the Warren webinar in the body of the email, but it does have a link, and that link takes you to our service that provides those transcripts. That's a cloud service that we utilize in order to get you all transcripts. If for some reason you did not get the email, or if there's a question about the transcript, you've downloaded it and you take a look and you see something is missing or something isn't there that you think should be, we ask that you email Scott Smith. He's my training coordinator here for the Virginia section, and his email is listed there at the bottom of the screen, scott.smith@vaawwa.org. He is very happy to help research what trainings you had logged into. We do have logs of every single week that we've held these trainings. We do some research just to validate that you were there and participated, and we can issue those credits. This would uncover, the transcript you receive would uncover from weeks 1 through week 7, and then we're going to hold off, and we won't send another batch of transcripts until the end. So week 8 and the weekly webinars we have moving forward, we'll put that out in the future at another time. But for now, you should be able to get transcripts. Again, emailed yesterday from admin@mail.eventful-us.com. Take a look for that email. And if you don't have it, or if you're not able to download the link, if you are in a situation where your computers or your IT department does not allow you to click a third-party link, just send Scott an email and he can do that for you and send it to you through a dedicated email. I'm going to go ahead and just share the results of the poll just because we've done it in the past. We have 37% are water operators, 20% wastewater operators, 30% are engineers, and another 20% of the people that took the poll are not in need of credits, but we're so glad that you're on the call. So thank you all for being here. With that, we'll switch it back to questions. I know there's a lot going on in the chat box, so take a look at that and ask any questions you have here at the end.
The chat box has been very busy. Jim Cherry just posted, one can smell chlorinated-free chlorine water, but chlorinated water does not have the same reassuring odor as free chlorine. So that's one thing to keep in mind too. So if you have any questions, any follow-up or anything else, or want to become a WARN member, Mike's going to give you a little piece here on that. But if you want to become a WARN member and you're not sure where to go, email one of the three of us, myself, Ike, or Mike Lynn with Albemarle, or Scott Shirley with Western Virginia Water Authority. Scott Shirley is the chair-elect, and he'll be taking over next year. Mike and myself will be wrapping up by Water Jam. We're done, aren't we?
Yes, you are.
We'll still be around.
3 wonderful years. Exactly.
Yeah, we've been extended a little bit, but we appreciate everybody who's been on, and we hope this has been beneficial for everyone. That there's some stuff. Nathan just posted, in your opinion, should all employees who travel by air on a vacation be required to wear a mask while in the airport boarding and on your flight? So if you're asking my opinion, I would say my opinion is yes, because you don't know who they're going to come in contact with, who's going to sneeze on them, who's going to be asking them questions that may or may not themselves have been in contact. Go ahead, Scott. I didn't mean to cut you off.
Oh, no, you're good. I was just going to say that's exactly how we treat it in our policy. We're encouraging employees to utilize masks in flights. The other piece I didn't mention in ours, it's automatically considered high risk if the employee goes to for foreign travel or for travel on a cruise. And so those are automatically 2 elements to our policy that we classify as high risk travel.
Very true. And remember, as water professional engineers, aside from the medical industry, you guys have the greatest impact on the health of the Virginians, of the Commonwealth of Virginia, of our citizens. So if you're sick, more than likely our citizens are going to be sick. So you guys do what's good for you, and it'll make everything better for the rest of us. And we're happy to be here to help you. Any closing comments? Mike, did you want to talk about joining the WARN? Or?
Well, to back up a little bit on getting out to the public about building flushing, if you have a public information officer, that would be a good resource. We are currently using social media. We have gone through Facebook, Twitter. We're using everyone that we can, Instagram as well. We can do that one link through Hootsuite. We are also have gone out to the local news media. They have done stories on the nightly news, on local news about doing some flushing. So take every opportunity you can to get the exposure out there and the message out. As far as joining WARN, it's the same thing with us. We are here to help you. We're here to help your utilities and your communities. And it's to your advantage to join WARN because we are a phone call away.
All right. Thank you, Mike. One thing I do want to remind everybody is all of our forward-facing stuff that we have up right now for COVID-19, at some predetermined time after we determine the emergency is over, we'll have to turn that back around, and you'll have to be a WARN member to see it. But I know we're not going to do it the day after our last webinar, but just keep in mind that if you are using our information, that at some point it will be turned back off to non-WARN members. I want to thank everybody who is taking advantage of it right now. That's what it's there for. But just keep in mind, if you're not a WARN member, we'd love to have you as a WARN member. Strength in numbers, definitely. Okay. Any last closing comments from VDH?
Hey, thanks for the opportunity
Tony,
to
Bob.
present.
Thank you,
Oh, thank you,
Ike, and we have our team. We really appreciate having us in this webinar, and we learned a lot. Thank you.
Thank you, sir.
You're welcome.
Okay. Geneva, any last closing comments?
No, just keep an eye out on the website. We'll be posting the link. Share this information with anyone that could not join today from your organization, and keep the waters flowing. Everybody have a great day.
All right. Thank you, everybody, for listening in, and thanks you, VDH, for presenting with us today. Appreciate it.